Welcome to the deep dive. Today, we're tackling heart health based on your request to really get into this.
That's right.
You've put together some key questions, and our mission really is to filter out the noise and give you the crucial stuff about heart health.
Exactly. We want to go a bit deeper than just the basics. Look at what's really causing heart disease, maybe some subtle signs,
Yeah, the early warnings.
and how our everyday lives, really shape our cardiovascular risk. Let's dive in.
Okay, let's start with the big one, main causes. What are we really looking at as the primary drivers of heart disease?
Well, it's not just one thing, of course, but big ones are high blood pressure, definitely, and unhealthy cholesterol levels.
Specifically the LDL, the bad one.
Yes, exactly. Too much LDL cholesterol. These things can, over time, damage and narrow your arteries.
Okay.
And genetics, well, they play a part too. Some people are just more predisposed. And then, of course, lifestyle, which I know we'll get to.
Great. That arterial damage sounds, well, serious. Are there subtle signs? Early clues our bodies might give us?
That's the tricky part. Sometimes early on, it's quite silent. But things to watch for include chest pain or discomfort angina.
Even mild.
Even mild, or just a pressure. Also, shortness of breath, especially with activity you used to handle fine. Maybe unusual fatigue.
Okay.
Or pain radiating, to the arm, neck, jaw. And remember, these signs can be different, particularly between men and women. So if something feels off consistently,
Get it checked?
absolutely, professional check is key.
Makes sense. So back to cholesterol and blood pressure.
Mhm.
How exactly do they cause problems for the heart?
Okay, think of that LDL cholesterol, the bad kind, like little bits of sticky stuff.
Right.
They can build up inside your artery walls, forming what we call plaque. This plaque hardens, narrows the space inside.
Restricting blood flow.
Precisely. Less room for oxygen-rich blood to get through. Now, add high blood pressure to that mix.
Okay.
That's extra force pushing blood against already stressed, maybe narrowed artery walls. It causes damage over time, makes clots more likely. It's a damaging combination.
Yeah, I can see that. So connecting this to what you said earlier, lifestyle. Where do we have the most control? What daily habits really impact risk?
This is really where you can make a huge difference. Diet, exercise, smoking or not smoking. Those are the big three.
Right.
Being sedentary, not moving much, really ups your risk. Regular activity actually strengthens the heart. Smoking, it directly harms blood vessels, full stop.
And alcohol.
Yeah, excessive alcohol isn't good for heart health either. Moderation is key there.
Stress seems like such a modern constant. How does chronic stress play into this heart health picture?
Stress, it's a big one. Chronic stress sets off physiological reactions. It can raise blood pressure, increase inflammation.
Inflammation throughout the body.
Yes. And often, stress leads to unhealthy coping mechanisms, right? Like reaching for unhealthy food, or smoking more, or maybe drinking too much.
So managing stress is heart health too.
Definitely. Finding healthy ways to cope is vital.
Let's talk diet then. If someone wants to make changes, what specific dietary shifts actually reduce risk effectively?
Focus on whole foods. Lots of fruits, vegetables, whole grains, lean protein sources like fish or beans.
Okay.
And try to limit saturated fats, trans fats. Those are often in processed foods. Cut back on excess salt and added sugars too. They impact blood pressure and cholesterol.
Any particular eating pattern that's good?
The Mediterranean diet gets a lot of attention, and for good reason. It emphasizes all those healthy components. Healthy fats like olive oil, lots of plants. It's well studied for heart benefits.
Good to know. Now, a point of confusion sometimes.
Yeah.
Heart attack versus cardiac arrest. They're not the same, are they?
No, absolutely not. It's a critical difference. A heart attack is a circulation problem.
Like a blockage.
Exactly. A blockage stops blood flow to the heart muscle, damaging it. Cardiac arrest, on the other hand, is an electrical problem.
Electrical.
The heart's electrical signals go haywire, become chaotic, and the heart just stops beating effectively. It stops pumping blood altogether. Now, a heart attack can sometimes lead to cardiac arrest, but they are distinct events.
That's a really important distinction. Okay, what about medications? We hear a lot about statins. How effective are they?
Statins are, very effective for many people at lowering that LDL cholesterol we talked about.
Right, the bad stuff.
Yeah. By doing that, they help prevent that plaque buildup, reducing the risk of heart attacks and strokes. Especially helpful for people who already have heart disease or are at high risk.
But it's not automatic, right?
No, never. It's always a conversation with your doctor,
Yeah.
weighing the benefits against potential side effects for your specific situation.
Makes sense. Looking ahead, what's new in prevention? Any exciting research coming through?
There's some really interesting work, things like genetic risk scoring, figuring out who might need earlier or more intensive prevention based on their
More
genes.
personalized.
Exactly. Personalized prevention. Also developing super sensitive tests, biomarkers that could maybe spot the absolute earliest signs of trouble even before symptoms show up.
Wow. Okay. So final practical point. Can we actually monitor our heart health effectively at home?
To some extent, yes. Home blood pressure monitors are really valuable tools. Many people find them useful.
What about wearables, like smartwatches?
Yeah, wearables can track heart rate, activity levels, that gives you data, trends over time, and just generally being aware of your body, noticing changes. But
But it doesn't replace the doctor.
absolutely not. These are tools to supplement, not replace, regular medical checkups and advice from your healthcare provider.
Got it. Well, this has been incredibly helpful, really clarifying a lot. The big takeaway seems to be understanding your own risks, knowing the signs, and making those active, healthy choices every day.
That's the core message. Knowledge plus action. That's your best protection.
Right. So, for everyone listening, maybe just take a moment and think, what's one single proactive step you could genuinely commit to starting today? Something small, maybe, that could make a real difference to your heart health down the line. Worth considering. Thanks for joining us for this deep dive.